Newly appointed Health Undersecretary Camilo Cascolan has formally taken his oath. This comes amid criticism about his capability to manage the health sector. Is the former Philippine National Police chief up to the challenge of delivering basic health services to the people? Good evening, I'm Pia Hontiveros. Welcome to your weekly political appointment fix, politics as usual. Here in the studio, we're going to have Health Undersecretary Camilo Cascolan. He's joined me here right now. But we're going to speak first to our guest on via Zoom, the board member of the Community Medicine Development Foundation and UP Manila College of Medicine faculty, Dr. Jean Nisperos. Good evening, Dr. Jean. Thank you very much for being with us. So let's begin with the reasons that you've already enumerated that you feel, kumbaga, all the wrong reasons for this appointment of Yusek Cascolan as Health Undersecretary.
Yeah, it goes without saying because we've learned a lot from our pandemic response, and most of the people who made decisions in terms of our pandemic response either came from the military or the police institutions. And for a lot of people, in the medical sector, in the health sector, the pandemic response totally failed to address the key issues in the pandemic. So now that we're moving towards, reestablishing a new setup, given that the pandemic still exists, it's very disheartening and very questionable to have another general, a retired general at that, to be appointed to the Department of Health portfolio, whether or not he has some level of capacity or background qualification in terms of his educational attainment. It really goes against the grain of having somebody who is familiar with the landscape of the health situation in the country, because the pandemic already showed us so many problems with that. And having someone with basically no background in terms of the health situation in this country, much less an understanding of how the health system works, really goes against the grain. Now, the other thing is, he's a former general who's been closely related. I mean, he worked for the implementation of Upland Double Barrel, which eventually became Tokhang. Now, it goes straight into the heart of two important things that the health sector really stands for. One is the value of life, and two, how we regard health in terms of how we value life. Now, if you look at how Tokhang was implemented, you see that the value of life given by those who implemented it is very little. And when you look at the pandemic response, health was not regarded as a right. So how would you put somebody completely bereft of those basic values at the heart, a breath away from the Secretary of Health? He's already an undersecretary. So that is a lot of things that we really have to consider.
Yes, you're right. A lot of things.
The other thing is,
go ahead.
Yeah, and the other thing is, given that he may have some qualifications that allow him to take the job, the real question is he the best person? Is there no other? If you're going to get somebody who will work for a field like health that is already inundated with a lot of problems, with a lot of considerations, and you're already trying to catch up in addressing these issues, you want somebody who can hit the ground running, who will not depend on consultants every step of the way, because he has barely enough understanding and appreciation of the scope and breadth of the health sector. So those are very key issues that we find very disturbing. In fact, my main point about his appointment is it's nothing more than a brazen display of patronage.
All right, you brought up so many points. Some follow-up questions.
That's the main point. Yeah.
Right. Some follow-up questions now, because you said no background, and earlier you've been quoted as saying, nothing in his experience merits the appointment. absolutely nothing ba talaga? There is nothing that General or USEC, now USEC Cascolan, would know that would be helpful in managing the health department and delivering basic health services.
All right. Let's be clear. Let's be clear. I also said that even if they extract an iota of qualification for him to fit the job, the real question is he the best person for that job, or are we just getting the bare minimum? Kahit pasabihin natin, even if we say that, hey, he has some management experience, he has run the PNP and therefore knows the ins and outs of managing such a big institution, is he the best fit for this particular job? Are there no other? That's the question that we really kasi pag sinabi natin, when we say that it's just a matter, is he qualified? Even if he has some qualifications, we're only looking at basically bare minimum.
But
and what we want really at this point is, given the fact, again, that we're already trying to catch up with a lot of problems exposed by COVID in terms of our healthcare system, we're trying to catch up. Now, if we're trying to catch up, you want the best people to be running the Department of Health.
Isn't someone who was with the PNP who specialized in operations, managing the organization, wouldn't that kind of a person be helpful in pushing health services to get to people who need them?
Yeah, ibang-iba kasi. It's not just a matter of managing things. It's understanding the nuances. It's understanding the extent of the health sector, understanding the historical problems that we have. Now, if you're going to ask me, shouldn't a general who's run something like the PNP be qualified? I would ask, shouldn't somebody, let's say, who's been the dean of the College of Public Health, or should somebody who's run a major provincial PHO, for instance, wouldn't they have the same manner of experience? And yet these other people would have a better understanding and a better perspective of the healthcare system.
Okay. Right? You also said this is a brazen You also said this is a brazen display of patronage politics, meaning may padrino si USEC Cascolan. Who would that be?
Definitely. Kasi
who would that
hindi
be
na siya, obviously it's not based on merit. Parang ang sinasabi sa atin, what being told is, I want him regardless of whether or not he's the best fit for the job. That's the message that's being given us.
Yeah. So
in fact, when you have a chief executive who's trying to fill up the position, we should hold that chief executive accountable for their choices of secretaries or undersecretaries.
Okay. Well, speaking of filling up the position that needs to be filled is Health Secretary. Very quickly, just off the top of your head, sino yung gusto nyo maging Health Secretary?
Wala pa. I don't want to endorse anyone.
You don't want to endorse anybody.
Spot,
okay.
Right?
Yeah. All right. Well, thank you, Dr. Jean. You're going to join us in the last segment of the show because for the next segment, we're going to have USEC Cascolan responding to everything you've said. So just stand by lang po, Dr. Jean Esperes. We'll be back after a quick break. Stay tuned. This is Politics as Usual. Welcome back. This is Politics as Usual. Our next guest, newly appointed Health Undersecretary Camilo Cascolan. Good evening, USEC Cascolan. Siguro kanina pa kayong, parang siguro mainit yung upuan nyo kasi niro-roast na kayo ni Dr. Jean Esperes, who's still waiting on Zoom, no? But before anything else, sir, I wanted to be the first to greet you in advance because it is your birthday tomorrow, your 58th birthday tomorrow.
Yes,
Happy birthday. So in spite of everything, masaya pa rin ang birthday
yes,
nyo.
of course.
Of course. All right. Well, so how did this all happen, sir? No? You were USEC in the Office of the President nung panahon ng Duterte administration. Is that why they thought of getting you? Kunin natin si Picoy. Ganun ba? Or, how did this all happen? Sino yung tumawag sa inyo? What is the recruitment
Actually, when I was the... good evening, Pia, and good evening to all those who are listening right now. Before I came to the DOH, actually, I resigned as the Executive Director of the Program Management Center of the Anti-Terrorism Council. And it was one of my forte, considering that I came from the PNP. And we also have a military background. But at the same time, we have to resign in July 1. And we just waited for any any kind of assignment that would be given to us.
So sinabihan po kayo na bibigyan kayo ng assignment?
Well, no. Actually,
appointment?
no.
Ah, hindi.
No. We just resigned because of EO1. And then after that, I also applied. And I was being asked
Applied for what?
I applied for, that was more or less 3 to 5 positions. Well,
Ano yung 3 to 5 positions?
wag na lang, Pia.
Sige na, sir.
No, I applied actually. It doesn't matter.
Then, what department na lang?
Actually, it's more on military and those involved in the End Local Communism Armed Conflict, or the LCOC.
Okay.
I would rather, I was choosing it to be there. I was choosing myself to be there because that is my forte, that I would
Yes.
like myself to be considered then.
Yes. Oo.
But I was also asked if it would be good for me, or I would want to be placed on other departments different from what I have learned or what I have experienced. And I said yes. I'm willing to take the challenge, of
Kahit
course.
anong department? Or sinabi na sa inyo na sa health ka namin ilalagay?
Not necessarily the health, yes.
Okay. Okay. So, tumawag sa'yo, sinabi. And then, how immediately did you say yes? Or did you say, bakit DOH? Ganun ba? Or...
Actually, no. They just told me that basta anywhere for as long as your managerial and administrative forte will be used. And I said yes. And you know, Pia, I would just want to say to Juan, experience is different from theory. Theory is theory, and it's just there sitting down.
Yeah. When you're in the field, on the job, outside.
On the job,
on the ground.
everything is now what you learned in school are just basics. Different if you're in the field, you have to actually do a lot of or initiate a lot of activities that is actually not even a norm. Sometimes you have to get out of the box so that you would be able to implement things that the government really wants. No? Dito tayo bumabawi. And of course, I have helped. I have had a lot of things done when I was in the Philippine National Police. Not only when I was a chief PNP, but growing up, I did a lot of things, and I could say that I have left a legacy wherever I went.
And of course, nung nag-umpisa ang pandemic, March 2020,
Yeah.
you were already, was it TDCO or?
I was then the deputy chief for administration.
Administration pala, sorry, yes.
And we were called in Malacanang, considering that our chief PNP then, General Archie Gamboa, had a chopper crash. So I was the one who represented him in Malacanang, and we were immediately ordered to come up with initiatives to fight the COVID pandemic. And I had to start the technical working group. We actually, to be frank, the Department of Health was even part of our meeting, first 2 meetings then. And I remember it was Secretary Duque who was there, together with 4 other doctors from the DOH. And we actually created what we called, he was not there anymore when we were able to strategize the COVID task force, anti-COVID task force, which I gave to General LSR, the DCO, because it's operational matter. After giving that, after establishing that, I have to create again the admin support to COVID task force, which is administrative in nature, of which it helped the operational activities.
And that was what you were known for in the PNP, sir, hindi po ba? Managerial and
Yes.
administrative.
Yes, and strategic, of course, strategic initiatives.
Okay. As USEC of Health, you were telling me earlier that you're going to be the head of the Field Implementation Coordinating Team for the Visayas. What exactly does that mean?
Well, we are overseers. We have FICTs, as they call it. FICTs for NCR and Luzon, Visayas, and Mindanao. As I was told and briefed personally by the OIC, Rosario Vergere, she told me that we will be overseers of the implementation of programs in the field of the DOH. And
Who created the FICTs?
I still have
Sila
to,
na sa DOH na.
DOH,
Okay.
yes.
This is not
Matagal
something
na
you thought of. Sila na yon.
Yes.
Okay.
And this was operational management, actually.
All right. So what is it? Parang pushing supplies to the front lines? What exactly? Basta
Managing the
lahat.
supplies, managing the operations of DOH, helping out the regional directors, and of course, overseeing the implementation of these policies, of these programs operational programs in the field.
Yeah.
Of course, so that it would be re-echoed or cascaded to the masses.
Oh, the head for NCR plus Luzon and Mindanao are doctors.
Yes, I think for Luzon it's Dr. Santiago and Mindanao is Dr. Dumama.
Do you feel in any way that you're not being a doctor is going to be a hindrance to your doing your job?
No. I believe this one is more operational because I've seen the directive from the DOH department, the Department of Health, and it talks about overseeing implementation of programs which are actually operational in nature.
Would you know, I'm sure siguro napag-usapan yon, no? When you say they, and I was going to say sino yung they, no? Pag pinag-uusapan yung health secretary, would you know kung sino yung magiging health secretary? Was that even offered to you?
No.
You have that? No, definitely not.
For me to it's I would want to correct also Dr. Jean, of course. I will not run the DOH, as he said. I
You're
think she
running
mentioned
that FICT for Visayas.
Yes. And I am a member of the DOH team. A new member of the DOH team who is willing to learn. And at the same time, I just hope that they could also learn from me. But of course, this one is DOH. I will learn much more from them, and I would be trying my best to actually help out.
Yeah, I asked you if you know kung sino yung magiging next DOH chief. You don't, or you do?
No, I don't know.
No, you don't. But because and I asked you that because the last time I interviewed you, sir, I think that was late 2020 October via Zoom. At that point in time, bigla ang kasing na-announce na kayo na yung chief PNP. I wonder if you remember that, no?
Yes.
And during that interview, so baka naman kasi bigla mag-announce sila ngayon na Cascolan, new DOH secretary. Daming magagalit na naman. But anyway, sir, thank you for being here. You'll join us in the last segment of the show together with Dr. Jean Esperos. More from our guests when we return. We're into our final stretch in just a bit. This is Politics as Usual. You're still with Politics as Usual. Still with us, Health Undersecretary Camilo Cascolan and Dr. Jean Esperos joining us via Zoom. Final words and final questions. First for Dr. Esperos. Kanina, you were pointing out that, why is a police general, a retired police general, even a health undersecretary? Corollary, we can also ask the question about, do doctors always make good administrators? At the same time, I wanted to ask you if are you going to give Yusek Cascolan a chance to do his job, or are you going to write him off already?
Thank you, Pia, for that question. First of all, I'd like to thank General Cascolan for being candid enough to tell us that he applied for a job within his forte, which is the military institutions, including the NTF-LCAC. That tells a lot because, the existence of the NTF-LCAC and the health department, the health sector, completely anathema to what each institution stands for. Now, whether or not we're going to give General Cascolan a chance is not for us because he's already been appointed. But would we stop criticizing the appointment? Of course, because of course not, because the appointment itself is very questionable. Even though he says that he is going to implement the DOH programs, for instance, in Visayas and Mindanao. So let's take an example, the Universal Healthcare Law. Ang daming factors niyan that need to be put into place. No? The social service delivery network, the interaction between private and government institutions, the lack of health facilities and health workers. Ang dami niya. No? So while I agree, maybe he's sincere in wanting to help and think out of the box for solutions, he is coming from a very difficult position of not fully appreciating that. Now, this is nothing personal against him. What we want is to not just for Secretary Cascolan, for General Cascolan to not be appointed, but to end yung brazen political appointments. We want leaders in this country to have merit and for the appointing authority to be held accountable for their appointments.
All right. Yusek Cascolan, first respond very quickly to that issue. No? Yung NTF, sabi niya, nag-apply kayong NTF-LCAC. Sana, pero yun na nga, anathema, magkasalungat yan dun sa service in the health sector. At the same time, earlier, may sinasabi din si Dr. Jean, about human rights, the respect for human life na hindi yon naipakita ng PNP kahit noong kayo ay Chief PNP?
First of all, let me say that I did not apply for NTF-ELCAC. What I said was I applied for positions which are actually corollary to say with the to my job as a PNP and military officer.
But you did mention yung
yeah, I did mention NTF-ELCAC, which is I said was I did not apply in NTF-ELCAC. I applied for positions which is actually the same or familiar to NTF-ELCAC.
Okay.
So secondly,
can you tell us what position that was, just to be very clear?
Well, I applied for for national security positions actually. Yes.
Okay. All right.
Well, first of all, when they say that the PNP was not good in kwan or palpak po yung ating kwan, my respects to Dr. Jean, but for everybody to know, the PNP were the first ones who actually responded in the anti-COVID pandemic. We were the first ones who actually came up with initiatives that would be able to at least deter or prevent the entry of COVID. Secondly is, in the PNP alone, there were a lot of medical initiatives that were done by PNP officers because I was at the helm then of anti-COVID. We were the technical working group. Secondly, during the time of President Duterte, the Vice President told me in front of General Quino, who was with the PIDEA before, your program on double barrel is on its right place. It was actually very clear that it was good and there was only something wrong with regard to the implementation. And with regard to the implementation, there were a lot of PNP officers who were actually arrested, filed cases for abuses. No? And thirdly, I would want to say that our forte, most especially me, when it comes to managerial and administrative positions, is the morale and welfare of the people. And when you talk about morale and welfare of the people, it encompasses everything. Health, social responsibilities, spiritual, everything. No? Because everyone needs to be needs to have a high, needs to have their morale high, and their welfare to be taken care of, so that performance will actually come out of them.
Well, you know, maraming nabanggit, both ni Yusek Cascolan and ni Dr. Jean Nisperos, kaya lang ubusa talaga yung oras natin. So, we'll have to cut this short. I guess we need a part 2 for this, Dr. Nisperos and Yusek Cascolan. Wala talaga oras.
Thank you, Doc Jean. Thank you, Doc.
Salamat, Pia.
Lalo na kapag kumukontra kayo sa... pero I'm sure General Yusek Cascolan, siguro yung theme song nyo, Give Me a Chance. You have 10 seconds.
Yeah, Doc Jean, thank you very much for opening actually the eyes of everybody. But let me say that I was also once an activist in UP Baguio, and we had a lot of things done. For these things, I was able to experience a lot of things that would be able to help our country indeed.
All right. Maraming salamat to our guests. Like I said earlier, Dr. Jean Nisperos, thank you very much, and Yusek Camilo Cascolan of the Health Department. We've been told before, don't talk politics at the dinner table or the family reunion or in Viber groups and risk warfare, digital or otherwise. But we can talk about it here at this table on this show, your weekly political appointment fix, politics as usual. I'm Pia Hontiveros. See you back here next Wednesday, 8 p.m.